Hi, this is Kaushik, lecturer from the Cardiovascular and Pulmonary Department, Faculty of Physiotherapy, Dr.M.G.R. Education Research Institute. Today, we'll be seeing about electrocardiography, that is, in short form, ECG. So, ECG, this machine is basically a sophisticated galvanometer which detects the presence of current. That is, here in the sense, current means detecting the conducting system of heart. That is, electrical impulses generated from the heart to find out whether they are normal impulses or abnormal impulses like any cardiac arrhythmias. So this machine is predominantly indicated for patients who are being suspected for any heart diseases like myocardial infarction or any critical care situations where the ECG is used to find out whether the patient has a shockable rhythm or a non-shockable rhythm, and in few cases like valvular heart diseases, coronary heart diseases, and etc. Now we can see the demonstration on the lead placement of the ECG. So the ECG basically has two sets of leads, that is unipolar leads and bipolar leads. The unipolar leads will be your chest leads, whereas your bipolar leads will be your limb leads and the augmented leads, that is the AVF, AVL and the AVR. So since these leads are dry and they have a metal padding, you need to apply gel so as to make sure there is adequate conduction between the leads and the patient's tissue, that is the patient's skin. So we have two systems of lead placement, that is, one is the AHA, that is American Heart Association standard, and the other is the International Electrotechnical Commission standard, so that is the IEC standard. So this machine uses the IEC standard lead, wherein you have the lead names, that is the red color goes on the right arm of the patient, the yellow color goes on the left arm of the patient, so the green indicates the left leg, and the black is the neutral lead, that is the N, which will go on the right leg. So these four electrodes, they basically form something called as the Eindhoven's triangle. Eindhoven's and limb leads are also called as the Eindhoven's leads because it was discovered by someone called as Willem Eindhoven. So that completes the Eindhoven's triangle. So this shows the Eindhoven's law, which is basically the potential difference across any two leads is the sum of, the potential difference across, the summation of potential difference across any two leads is the equivalent of the third lead. That is, the lead 1 plus lead 2's amplitude is basically equivalent to the lead 3's amplitude. Okay. Then we move on to the chest leads. And as I said earlier, we have two systems wherein the AHA and the IEC settings. In the AHA setting, you have V1, V2, V3, that is, they indicate precordial leads. Whereas in the IEC, that is this system, we have C1, C2, C3, which is the chest leads basically. So the chest leads will start with the intercostal spaces, that is how to palpate the intercostal spaces. You have the jugular notch here. Below the jugular notch, you have the first bony prominence here. That bony prominence is the angle of Lewis. Subsequent to that is adjacent to the angle of Lewis, you have the second rib. Below the second rib, the second ICS, then the third rib, then the third ICS, then the fourth rib, then you have the fourth ICS. So the placement of the C1, that is first lead, is right parasternally in the fourth ICS. So these are suction electrodes. You have to press the suction cups and you have to place them in place. And in the left parasternally in the fourth ICS, you have the V2, that is the C2 here. And after V2, you will have to go for V4 because V4 lies in the anterior axillary line of the 5th ICS, which is here. Because the position of V3 lies in between V2 and V4, always first go for the V4, and the V3's position is exactly in between V2 and V4. After this, you go for the V5 and V6. So the position of V5 is in the mid axillary line in the 5th ICS. the mid-clavicular line with the 5th ICS. And the position of V6 is in the mid-axillary line with the 5th ICS. So this is the placement of chest leads. Basically, the V1, V2 focuses on the septum, that is interventricular septum, and the V3, V4 focuses on the anterior right left ventricular wall, and the V5, V6 focuses on the lateral left ventricular wall. So once placing these, you start with the machine. So you power on the machine, and you can visualize the waveforms here. These are the 1, 2, 3 and the augmented leads. So the 1, 2, 3 are basically called as your Eindhoven's leads. This AVF and AVL, these augmented leads are called Goldberger's leads. When you want to shift leads, you want to visualize the precordial leads or the chest leads. You can see the V1, V2 to V5, V5, C6 here. So once you get a satisfactory ECG pattern in the machine, you give the print option and you get the physical printed version of the recorded ECG. So this is the recorded version of the ECG which we saw in the machine. This is for the documentation purpose. So the main purpose of this machine is only for learning purpose for the UGs as well as the cardio PGs. Thank you.